Thank you for joining us. This is Jody Tropiano, the Content Director for Health, and I'm lucky to be here with Dr. Stacey Lindau, who is the founder and Chief Innovation Officer of NowPow. Dr. Lindau, thanks for joining us.
Thank you for having me, Jody.
So we're going to chat mostly about the COVID pandemic today, but before we dive in, just wanted to hear a little bit from you about your inspiration to start NowPow and connecting kind of social care and self-care, and where your inspiration truly came from.
You know, the context in which we're speaking today touches very closely on my life's motivation, and it was that motivation that led to NowPow. I'm originally from Detroit. I was born there in 1968 in the midst of another uprising, not unlike the one we're seeing today. And I've had deep in my heart for my whole career, really my whole life, that somehow my life's work would be contributing to mitigating the ills of racism in our society. NowPow is a company that came from an idea that gestated on the south side of Chicago, where I work as a practicing physician and as a professor. And the idea was this: the idea was that we can be healthy and we can see strong economic vitality in all of our communities if we understand the assets of our communities, if we understand what's working, and if we can connect people to what's working, so we all can do what we want to do, which is take best care of ourselves. As much as I like taking care of patients, I too am a patient sometimes, and I know that everybody would prefer to stay well and stay out of the doctor's office. And the way we care for ourselves is in all the things we do at home and on all the resources and assets we draw on in our communities. So the idea for NowPow is that in order to enable everybody a fair chance at taking care of themselves, everybody needs the best, most reliable, most personally relevant information about the programs and services and supports in our communities that can help us stay well, that can help us manage with illness. Most of my patients have cancer, and until you had a cancer diagnosis, you didn't really need to know where the cancer wellness center was or where you were. But when you have a diagnosis, you need to start doing those things to take care of yourself. And everybody needs to know where to go for the resources to take care of others. More and more of us are caregivers for others. And so the idea of NowPow is that we should make it possible for doctors and other care professionals to connect people to the supports of our communities as easily as we can connect people to medicines. So we built the concept off the idea of e-prescribing drugs. And we said if we can get drug e-prescribing in the doctor's workflow, we can get community prescribing in the doctor's workflow. And that's really where the idea started.
Excellent. And so early on in your career with NowPow, did you ever imagine the role that this platform would play in combating a crisis like we're facing today?
We did. So the community stakeholders who worked with me and my team at the University of Chicago did understand that although we weren't in the midst of a pandemic, we were in the midst of an enduring crisis of inequity that impedes the health of people, Black and brown people especially, but marginalized populations of all kinds. It's hard to think of that as an emergency because it's been going on for so long. But when we look at how we're going to promote the long-term health and economic vitality of the communities we serve, we understand that addressing these basic inequities, basic access to nutritious food, access to good quality education, being able to fulfill one's full capacity for employment, these basics are essential to health. And in our original work, we saw the lack of attention to those issues as a crisis. And we very much envisioned that if we could build an infrastructure that would enable doctors and nurses and social workers and the full range of community-based organizations to easily know what businesses and organizations were open and operating and for whom, that this infrastructure would be critical, not just for dealing with the endemic crisis, but for dealing with emergencies. When we started, we saw Hurricane Katrina happen. We saw fires happen. We saw wars happen around the world. And in every instance, we said, we wish NowPow, or we wish our work was up and operating there. And so I feel like NowPow has been planning for this emergency. And the customers who worked with us were better prepared because they had this infrastructure in place.
And how specifically are you seeing health inequities exacerbated in the face of COVID-19? And then how are you seeing the different players within the health ecosystem responding to those inequities?
I live in Chicago, and I love Chicago. It's a beautifully diverse city in every way. About 30% of the population of people in Chicago identifies as Black or African American. As many as 70% of the early deaths from this pandemic were among African American people. I expected there to be a disparity. Forgive my ignorance, but I never expected it to be that big. And this just calls us to recognize, and there's just no refuting that a disparity like that has its roots in enduring inequities. So the COVID-19 pandemic has put a great, big, undeniable, irrefutable spotlight on inequities across racial and ethnic lines. And although the African American community is particularly vulnerable in this crisis, we also see vulnerabilities among other minority, ethnic, racial and ethnic minority groups, as well as older people. And that is a serious concern. So the pandemic is calling attention. The crises that are leading to current uprising, protest, and attention to Black lives is calling attention. And I think an optimist would say now is the time to recognize we cannot deliver good medical care if we do not attend to these basic inequities. And we can implement infrastructure that allows us to attend to these inequities in our everyday work.
That's an excellent point. So what specifically are your customers doing, whether they already had plans in place? Are they plowing ahead, or are they really pivoting their business models right now?
You know, we're seeing a great deal of new activity with our business partners. I would not say that the vast majority of them are slowing down. In fact, everybody's been looking for what can we do to support the patients we care for but can't see right now, and how do we support our workforce of people who also have been really restricted in what they can do in terms of coming to work and caring for others, which is the core business, of course, of most of our customers. So many of our customers have availed their employees of our technology, recognizing that anybody who works in a healthcare system, or even anybody who works at a health insurance company, is regarded by the people in their family and in their communities as a healthcare expert. So customers are making our technology available so those individuals can identify the resources they need for themselves, their families, and for the people who call them for help. We also see our customers making our technology more widely available to the community-based organizations with which they partner. We see we have a new relationship with Blue Cross Blue Shield New Jersey that's making our technology available statewide based on a successful pilot they did, showing that connecting people to health resources in their community generates cost savings. And so NowPow is working harder than ever. And frankly, if you asked me before this pandemic if I could work any harder, I would say no. And I'm sure everybody at NowPow would have said the same.
Yeah, that's excellent. So you often use the term whole person care. when you're referring to SDOH. So can you just expand upon that a bit and maybe tell our audience what you mean by that?
Yes, the phrase or the acronym SDOH, of course, refers to social determinants of health. And 5 years ago, this was a phrase that nobody knew. If I asked my medical students what does SDOH stand for, they'd probably be trying to come up with something related to kidney function. Today, the phrase is known, and I would say it's even iterated a little. Some would use that acronym or that abbreviation to mean structural rather than social determinants of health or socioeconomic determinants of health. The Centers for Medicare and Medicaid Services, the National Academy of Medicine by virtue of giving us measures of social and structural determinants of health, have helped us think of these factors in terms of things like availability of food, ability to get transportation, safe and secure housing, et cetera. But those are really risk factors or socioeconomic vulnerabilities. And those are things we can assess and address in our caring for people. Social or structural determinants of health are really factors like policies, laws, racism. Those social and structural determinants are extremely important. And I think that we believe that by systematically identifying people's needs and connecting them to the resources they need, we can start to understand what the levers are to pull to address those social and structural determinants of health. But individuals don't have their own social determinants of health. They live in communities and societies that have those determinants. Now, whole person care means that when we address the needs of people, we don't just ask them, do you need food or housing or rent and utility support? And when they say no, we say, good, you're okay. We recognize that a person who does not have these vulnerabilities, but is now diagnosed with a new illness, can very quickly develop these vulnerabilities. And again, the pandemic is a great example or a sad example of people who were food secure, and a month later, they're not food secure anymore because of all the barriers to getting food during the pandemic. So a whole person approach, just like drug e-prescribing, says if I'm going to build an infrastructure to connect people to the resources of our communities, I'm not just going to build an infrastructure that connects people to food and housing and transportation. That infrastructure, that very same infrastructure, also needs to connect people to cancer support resources and diabetes support resources and dementia caregiving resources and bereavement support resources. We would never have built one drug e-prescribing system for asthma and then a different one for hypertension and yet another for, prenatal vitamins. You build one infrastructure that takes care of whole people and allows us to address both people's basic needs as well as their self-care and caregiving needs.
And so over the past few months, I'm sure you have many answers to this question, but maybe say top 3 lessons learned that you think hospital and health systems have really come to terms with over the past couple months and maybe will change their business models moving forward.
One observation we've made through our work, going back to the beginning of our development of Community RX, which then led to NowPow, is that people need information about community resources. People will use information about community resources, and people will share with others the information they get from their doctor about community resources. And these observations we've seen repeatedly. There was a bias early on as this market was forming that unless a referral was a tracked referral, unless it was a closed loop referral, unless somebody on the other end told me, yes, your patient did come for methadone, the referral wasn't useful. I see a shift today. We realize that in the midst of this pandemic, we can't track every referral to every food support for the vast number of people and growing who need food support. but that doesn't render the information useless. So we're starting to see the market comprehend that there is value in one-way referrals for people who are in need. There is also value for a subset of people in the closed loop tracked referrals, and there's value in highly coordinated referrals where an individual gives permission for multiple organizations to care for them simultaneously. But we shouldn't have a one-size-fits-all, and we shouldn't throw away, unidirectional referrals because they're not being tracked. I mean, that just makes no sense, and I do see a shift in thinking around that. I also think we've seen healthcare organizations recognize themselves not just as deliverers of healthcare to patients, but also as very significant employers. The University of Chicago, where I work, is one of the biggest employers in the whole region. And we take pride in the fact that many of our employees come from the immediate communities where we operate and that we serve. And those communities have been hit very hard by this pandemic. We're seeing more and more of our customers recognize that their employees, as well as their patients, benefit from stronger connections to their communities. And then lastly, you asked for 3 points. I would say lesson learned. A crisis is not the time to attempt to implement infrastructure for the first time. Infrastructure that works well in a crisis, infrastructure that can really change outcomes and change lives, is in place. It's ready to go. We know what all the assets are. We're ready to leverage them. And if I may give you my best example of this, it's one of my favorite analogies, and my colleague Dana Weiner at Chapin Hall shared this with me. When Apollo 13 went into outer space and the oxygen tank exploded, by all measures, we should have lost not only the spacecraft, but these 3 incredibly valuable astronauts on board. The only reason NASA was able to bring that spacecraft back to Earth with 3 intact astronauts was because they had an expert on the ground that understood every working part of that spacecraft. And they could focus on what was working and how to make it work enough to save the astronauts. That's the approach we take to communities. We need to know what's working, so if something goes wrong, we can quickly repurpose it for success. Mm-hmm. But if you go into a crisis not knowing your community, not knowing what's working, you're at a very significant disadvantage.
Mm-hmm. I love that. That's a great analogy. And so you mentioned the importance of community. And we know that hospitals are stretched very thin right now, but also community-based organizations are stressed equally thin, arguably. So what support could we give them right now to make sure that they are getting the resources they need, and we can ease some of the stress on them?
Yes. So I'll wear my hat as the president of the board of a nonprofit community-based organization that employs youth. And I've been in the thick of it with everyone else trying to figure out how we survive this pandemic. First and foremost, my community-based organization only works if people know what I do, who I serve, if I'm open and operating, what do I have to offer? So one of the things that we are doing with community-based organizations is making sure that everybody has accurate information about them. Everybody knows if they're open and operating and what they have to offer. And we're matching people to what they have to offer, so the community-based organizations aren't burdened with having to tell people who aren't eligible or who they can't help that they have to go somewhere else. If people do have to go somewhere else, the community-based organizations at the very least have access to our technologies so they can help navigate people to resources that are more relevant. We offer community-based organizations a huge capacity to communicate with people in more than 100 languages. So we can generate these community resource referrals automatically in people's preferred language. And as you know, language is a huge barrier to helping people, and people who don't speak English in our country are oftentimes marginalized. We give our community-based organizations screening functionality so they can quickly assess the needs of their clients and capture those data. And as you know, data are critically important to community-based organizations. Those screening data, the referral data, their ability to deliver services to people in need are essential for them to make the argument to their board and to their funder that they're relevant, that they're doing good quality work, and sometimes even help demonstrate that there's more demand than they can supply, which is data they need to show that they need resources to expand.
That's great. And so looking back at this, crucial period in history right now, 2020 so far, do you think that looking back, we will say that this time period marked a permanent shift in the way that our industry addresses inequities in health?
Oh, I hope so. I've been practicing medicine for 20 years, and the only other opportunities I saw for transformation along the lines of what is possible now happened in the context of very serious natural disasters affecting the southern part of the United States and Puerto Rico. And unfortunately, I'm not sure how much stronger we emerged after those events. They were a call to action to us, to do better and more, to be able to serve a broader range of communities, and we've continued to grow as fast as we could to do that. This period seems different, if only for the fact that a pandemic, thankfully, is a rare event, and a pandemic of the scale and impact like we've seen in the United States is a rare event for us, and I think it has gotten some attention. Layering on top of that the very serious issues of racial justice, frankly, of white supremacy and its implications. Our mayor yesterday spoke of slavery as the original sin of our nation. These are words that we have to say out loud. And for the first time in my career, I'm hearing people in the healthcare system talk about things like racism and white supremacy and slavery and the relevance of those things to the disparities we see in care and to the suffering, the disproportionate suffering of communities of color. Mm-hmm. So I believe that there is both a clarion call from this pandemic. I believe that the uprising is gathering momentum as it should. And for the first time, we have infrastructure in place in the form of healthcare policy, value-based payment, rewarding value rather than fee for service, and technology. A growing market of technology companies like NowPow that are making it our business to systematically connect people to the resources of their community. So I think it should be different this time. And I hope it will be, and I'm going to do everything to see it be.
I hope so as well. And so you just made a lot of great points there, but just any other final thoughts that you'd want to share with our audience, or any hope for the future?
Well, I appreciate your allowing me to say some words that are weighing very heavy on my heart. Although racism and a desire to mitigate the ills of racism has been a driving force for me, it's the reason I'm a physician. It's the reason I'm a physician practicing in one of the nation's largest African-American communities. It's a reason I founded NowPow and MapsCore, the youth-based community asset mapping organization I mentioned before. The fact is, my skin is white. The fact is, I have to examine myself and the words I say and the decisions I make every day to be a more effective advocate and ally on the problem of racism. And do I feel hopeful? I think I do. Hope is a choice, but Dr. Martin Luther King in his letter from the Birmingham jail, which I've read many, many times, and I encourage the viewers to read it if you haven't already. He speaks of hope, but he says that hope is not enough. Action is needed, and action with vision, action with courage is what we need to do to promote the health of our whole population. It's what we need to do to recognize that anyone who is unjustly ill means we are all not as healthy as we could be.
Mm-hmm.
And the pandemic itself shows us, if I take care of myself, you are more likely to be healthy. And not just because I'm a doctor, but because we live in the same community and in the same space. So I'm filled with emotion in response to your question. And yes, let us be hopeful and let us also take action.
Thank you for sharing those thoughts with us. Dr. Lindau, it's been a pleasure speaking with you. Appreciate all the work you're doing and hope we're able to catch up again soon.
Thank you for taking interest in our work. I appreciate it.
Of course. Thank you. Thanks for watching this interview. We're doing our best to keep our health community up to date and informed as the pandemic progresses. So please check back for more interviews and blog pieces with leading health experts, as well as check out our Health COVID resource page for more information. Thanks again.